we are going to discuss on our body changes during pregnancy and then after delivery, so that we'll be able to know why it is very important to go through the process of postpartum healing. First of all, let's discuss what happens during pregnancy. During pregnancy, our bodies undergo profound changes in order to support the developing fetus. These changes include hormonal shifts, and under hormonal shifts we have particularly progesterone and estrogen, which increases in order to prepare the body for the growing and birthing of the growing baby. First of all, let's look at the estrogen. Estrogen plays a crucial role in stimulating the growth of the uterine lining, which supports the growing placenta and the developing fetus. Estrogen also increases the blood flow or the blood supply to the uterus and also the breast in order to prepare them for labor and delivery and also breastfeeding. Elevated estrogen levels contribute to changes in the skin, in the hair, and also overall maternal well-being, therefore reducing the risk of early labor. That's all about estrogen. So let's move to progesterone. The progesterone helps maintain the uterus lining and also prevents premature contractions by relaxing the smooth muscles of the uterus. It also plays a crucial role in modulating the immune system to avoid the rejection of the fetus. And as you know, the fetus is of different genetic material from the maternal genetic material, and therefore it has the risk of being rejected by the maternal immune system. So therefore the progesterone helps in modulating this maternal immune system and therefore preventing the fetus from being rejected by the maternal immune system. Progesterone also supports the growth of the breast tissue, which will help in milk production after giving birth. Progesterone also helps the body to adapt to the increased metabolic demand by the pregnancy. We've been able to look at the shifts in the hormones, and these two hormones include estrogen and also the progesterone. So let's look at the uterus. The uterus expands significantly in order to accommodate the growing baby. You can imagine the size of a uterus is very tiny before around 8 centimeters before conception, and after conception and during the growth of the fetus, it grows all the way up to here. It expands significantly in order to accommodate the growing baby and also the placenta. Then the cardiovascular system, that is the heart, the arteries, the blood arteries or the blood vessels, work harder in order to supply the sufficient blood to the placenta. And what is the importance of the placenta? The placenta serves as the primary interface between the mother and the growing baby and the fetus. The functions of the placenta include 1. Nutrient and oxygen exchange. The placenta facilitates the transfer of essential nutrients and oxygen from the maternal blood into the baby. Also, it helps in the removal of metabolic products or waste products like carbon dioxide or carbon dioxide from the blood of the fetus back into the blood of the mother. This ensures that the developing fetus gets the required nutrients for growth and development, and also it ensures that the fetus eliminates the metabolic byproducts or the waste products into the mother's bloodstream, which is able to remove these wastes in form of carbon dioxide and urea through the urine and other byproducts. And this way, it ensures that the fetus is growing properly or well, and it is well nourished. Number 2, the placenta is very important in hormone production. The placenta produces the key hormones that help in sustaining the pregnancy. For example, human chorionic gonadotropin, HCG, which supports the corpus luteum in producing progesterone early in pregnancy. Another hormone is progesterone, which helps sustain the uterine lining and prevents premature contractions. And then the third one is the estrogen, which stimulates the uterine growth and blood flow and support the fetal organ growth and development. The function number 3 for the placenta is immune protection. While the placenta allows the exchange of nutrients and gases, it also acts as a barrier to many potentially harmful substances and pathogens. Pathogens are the disease-causing microorganisms. Providing a level of protection to the fetus, it helps modulate the maternal immune response to prevent rejection of the fetus, which is genetically different from the mother. In summary, the placenta is very essential in sustaining the pregnancy, supporting fetal development, and also preparing the mother's body or the maternal body for childbirth and breastfeeding. During pregnancy, weight gain and changes in posture can affect the musculoskeletal system, leading to common discomforts like back pain. The digestive and urinary systems also adapt to the increased pressure from the expanding uterus, affecting digestion and the bladder functioning. That's a quick summary of what happens to the body during pregnancy. So let's look at what happens to the body after pregnancy so that we are able to grasp the importance of postpartum healing. So what happens to the body after delivery, that is after the pregnancy? After giving birth, the body begins the process of postpartum recovery. The uterus contracts back to its pre-pregnancy size in a process called involution, which causes bleeding that takes place for approximately 6 weeks, which is known as luteal. Involution may also cause cramping, like those crampings similar to the menstruation cramping. Hormonal levels of the mother after delivery also shift rapidly, and this can affect both the emotional and physical sensations of the mother. And that's why you find that during postpartum we have a lot of emotions as women or as mothers. One minute you're crying, another minute you're finding this love for your child, and the other minute you feel so much discouraged. And this is all because of this shift. Some of the hormones that change rapidly after delivery is the oxytocin and also the prolactin. Oxytocin levels surge during labor, facilitating contractions and aiding in the delivery of the baby. Postpartum oxytocin continues to support maternal bonding and promotes milk ejection during breastfeeding. It also helps contract the uterus back to its pre-pregnancy size and reduces postpartum bleeding. Prolactin increases significantly after birth to stimulate milk production, and its levels adjust in response to the baby's feeding needs, ensuring that the mother can provide adequate nourishment. Prolactin also plays a role in maternal behavior and bonding by influencing mood and emotional responses. Understanding all the hormonal changes in your body is crucial in managing both your physical and emotional changes and transitions to pregnancy and postpartum recovery. And it is very important to understand the hormonal changes, because you understand that this is normal and with time it will end. And this, the understanding, because remember that every battle is won or lost in your mind. Whenever you have this understanding on what happens in your body during postpartum and also during pregnancy, it helps you conquer and know that these things happening are normal, and they happen to normal people, and it's for a season, and after this season everything will be okay. Having understood what your body goes through during pregnancy and also after delivery, we can all agree that our bodies are strong and they have accomplished something great, something extraordinary, something great, bringing forth life. Imagine conceiving that life, supporting that life for 9 months, and bringing forth that life into this world. That is amazing to you as a mother. It is also amazing to see the work of God, the miracle of childbirth. After all this that the body has gone through, it is very important to focus now on our body and physical recovery, both physical, emotional, and psychological recovery of our bodies, so that we are able to serve this child that we've given birth to, other children and other people who matter in our lives. We are able to take care of them when we are healthy. After understanding what happens to our bodies during postpartum and also during pregnancy, so let's move into how now are we going to undergo the process of recovery postpartum.